name is Jonathan Gardner. I'm 18 years old, and I live with my parents in East Bridgewater. My parents are my mom, Nancy Gardner, and my dad, Glenn Gardner. And also I have a brother named Eric Gardner. I have autism, and I have cancer. So far in my experience with medical people, it's been good for my cancer and all that. My oncology team has been truly amazing. I've had an interesting experience with others. Not bad, but interesting. But I've had truly one bad one. Let me tell you about that one. At the beginning of all of my cancer treatments, around, I want to say, cycle 2, at the middle of the night I was having some pain in my chest. I thought I was having a heart attack. So, we went to the hospital. So after we got there, we had to go to the emergency room. I was tired and in so much pain. I literally thought I was having a heart attack again. My mom came to the ER with me as my support person, and thankfully, she did. My experience in the emergency room was a nightmare. One nurse treated me like a baby once she found out that I had autism. She spoke really loud to me and really just did not treat me like a young adult at all. And, which I found very disrespectful, especially since I was in extreme pain and discomfort, and then she left me alone for hours when I was in pain, and my mom had to continuously go and see if she could get me some fluids because I was extremely dehydrated at that point. The nurse that treated me disrespectfully came back to the room and gave me a bottle of water and talked again to me like I was a baby who did not understand things. And she just broke my heart and made me feel like I was going to not get any help at all. Pause. She never listened to my voice when I tried to tell her how I was feeling and what was going on. It got to the point where my mom had to ask for this nurse not to come in to the room again. It got to the point where she literally made me cry because I kind of just broke because nothing was happening. I felt extremely unsafe. And in the fact that I was in extreme pain and discomfort at that point, at least, the pain went down, but it got to the point where we didn't know what was happening, if we were staying or going, because the doctor said we were staying, but the nurse didn't tell us anything. So we had to literally just keep going and asking. And actually, a little side note, I didn't really want to bother anyone because I'm a nice guy. Just because I have autism does not mean that I should be talked down to or feel demeaned, or that I have literally no choices in my care. I am willing to share my experience and myself to help other medical people know how to care for anyone that comes into the hospital or needs medical help, no matter what their disability is. Medical care should be inclusive for everyone, whether you have a disability or not. I'm going to leave you with this. If you met one person with a disability, you met one person with a disability. Give me a sec. As humans, we are all different at the end of the day. Every last one of us.